we came up with a burr system that works, and it works very well. Not only at removing the cartilage in easy to access areas, but we have different shaped burrs to get cartilage in hard to access areas. So the technique is similar. I put a scope in the ankle or the subtalar joint or whatever joint it is, and now I can see everything. I have water flowing through. The burrs morselize the cartilage into a fine particulate that gets easily washed out of the portals. So I do not have to scrape with a curette and then put a shaver in and then unclog the shaver and then go back to the curette. This is very fast. And the burrs were designed not to be overly aggressive. So if I'm dealing with someone with a little bit of osteopenic bone, I may get into the bone a little bit, but it's hard to do so unless you really push. And so we have a second set of burrs. Once we get our cartilage down, now we perforate the bone. And I think that's important because other people will say, well, we simply use our cutting burrs or our wedge burrs. Those easily enter bone. And if you're not careful, you can do that. And remember, some of this is not going to be done arthroscopically. For instance, the modified lapidus or true lapidus. So if we're doing this with, say, fluoroscopic guidance, these cartilage removal burrs, you're able to use them in a way that's much more confident that you're not going to pierce the bone. So I like to see what I do. I like to, especially when we were designing these burrs, I want to know, do they work? So I did a lot of arthroscopic work, but based upon what I've learned from fracture work, I do a lot of dry arthroscopy as well. So you do not necessarily have to be a facile arthroscopist, but if you want to see and make your learning curve more accurate, I would say have an arthroscope available, a wet lap, and you can dab the arthroscope, stick it in wherever you're removing cartilage, and you can see. If you want a little bit more of an open approach so you can see deeply in there, you can do a 2-centimeter incision and a pin spreader technique. But yes, I think when you're first learning to use these burrs, remember, you do not want to leave cartilage behind. That inhibits healing. And so I think if you learn by using a tactile device, that's minimally invasive surgery, it's tactile, it's fluoroscopic. But if you can add anything in that gives you a visual cue as to what you're feeling, it helps. So minimally invasive, I think, is a very good way. Look with your eyes, look with a dry arthroscope, look and see what it feels like when the burr removes the cartilage, gets down the subchondral bone, and then when you use different tools to pierce the bone, see what it feels like.